Let's speak to Dr. Amish Adalja. He's a senior scholar at Johns Hopkins Center for Health Security. He's joining us from Pittsburgh. Thanks for your time. Just weigh in on what's happened over the past couple of hours.
I think this is an unfortunate turn of events, but it is something that we predicted would likely happen. This virus does not respect borders. It doesn't respect whether or not you're a world leader. And the testing policies at the White House were never going to be enough, because we've seen clusters of cases at the White House even before this current cluster that's happened. The president is somebody that is at high risk for severe complications. And so it's not surprising that he's received an experimental therapy as well as been hospitalized preemptively.
But why do you think the situation has changed quite quickly, in the sense that the White House announced that he had mild symptoms, and now he's being needed to transfer to the hospital? In fact, he's now arrived at Walter Reed.
It's not surprising that a 74-year-old would have an acceleration of symptoms that would prompt hospitalization, especially when you have the access to healthcare that the president does. So if you're having a fever, if you're starting to feel more fatigued, there's going to be people that err on the side of caution and hospitalize an individual if they have that option. So that's likely what's at play here. And anytime a 74-year-old has COVID, we have to have a low threshold for using hospital resources.
You were raising the point of the experimental treatment just a moment ago. So the president's physician has said that Trump received a dose of an experimental antibody cocktail that's in clinical trials. It hasn't been authorized yet. What does this all say to you, and what do you know about this drug?
Well, the drug is it's a cocktail of antibodies made by the company Regeneron. And we've seen some very promising data that this may be something that helps individuals not have a severe course of illness. And they've been using it in outpatients in a clinical trial. So to me, it's something that I think was a quick thing to grab off of the shelf to help the president, because it was something that had some data and it was available on compassionate use. We don't know exactly how well this is going to work. We're still doing clinical trials, and it's important for those clinical trials to continue. But it's not surprising to me, again, that you'd see the president get this type of a therapy, because they are thinking about using this more broadly, if clinical trials support it, to keep people out of the hospital.
So would you say that there's enough information about this drug if it's still in clinical trials?
No, we don't have full information about this. However, it was available on compassionate release. We're doing a trial right now. I think we'll get more data. The data that we have so far is promising. Obviously, this is something that the president had to consent to have. When we give somebody a drug on compassionate use, they have to go through a consent process to know what the benefit is, what the risk might be, and where the data actually lies. But we do give compassionate use drugs to people occasionally in situations like this. And again, because it is the president, I think that there were nothing was off the table.
The physician also said that the president is being given vitamin D and zinc, amongst other vitamins. What else could he be receiving?
Well, once he gets into the hospital, we'll see if he gets drugs like remdesivir, which is an antiviral that's available on emergency use authorization. It does not appear that he's sick enough to require a drug like dexamethasone. We usually reserve that to people who are requiring supplemental oxygen, and the videos of the president do not show him showing any signs of shortness of breath or needing supplemental oxygen.
What are the long-term impacts of recovery when you look at the broader picture, and someone in the president's age group and someone who has his sort of health characteristics?
It's hard to say, because some people in that age group do recover pretty quickly, but there are some that have lingering symptoms and take some time to get back to their full level of activities. It all depends upon what happens in the next week or so to see how severe these symptoms get for the president and if any of the therapies have an effect. But I do think that there is going to be a recovery period that's going to probably be at least a week or two that you will see him be unable to really return to his same level of activity. But hopefully we won't see any kind of severe complications requiring an ICU, for example, or anything like that.
Dr. Amish, we thank you for speaking to us on Al Jazeera. Good to get your thoughts.
Thank you.